Good morning, everybody. We're going to be studying in a couple of minutes. Next slide, please. So we're going to be studying now. Next slide. Welcome to our school mental health summit engagement, strong and more resilient learning from the COVID-19 crisis. This is our first day of virtual conference. The 2021 Northeast and Caribbean MHTC School Mental Health Summit brings together leaders, practitioners, researchers, and other speakers, stakeholders in the school's mental health field to share the latest research and the best practices. The conference emphasized the shared schools, family, community agenda to bring high quality and evidence-based mental health promotions, prevention, and interventions to students and family as a part of a multi-tier system of support. This conference is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center, or MHTC, housed at Rutgers. Schools of Mental Health Professionals, Department of Psychiatric Rehabilitation Counseling Professional. My name is Caribel Sanabria Velez, and I'm a school mental health lead of this center, and I will be hosting this conference session today along with our presenter. Next slide. This is session number 2, trauma-informed approach for school mental health providers. This is going to be from 10:45 to 11:15 Eastern Time. Next slide. In the next slide, next slide. Today's sessions, we're going to have session 3, 11:30 to 3 or 12:45. It will be comprehension school mental health, addressing elevated stress to trauma in schools. And then we will have session 4, 1:15 to 2:30 Eastern Time, taking off the mask, showing up your athletic self. Next slide, please. And today's sessions also, we will have session 5. It will be 2:45 to 3:45 Eastern Time, social and emotional learning, compassion pave a way, elevator teachers, leaders to support succession SEL. The full schedule and individual Zoom links will be found on our conference website, that it was also going to be shared in the share box. Next slide, please. The MHTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of the behavioral health and other related workforce to deliver evidence-based and empirically support practitioners to individuals with mental illness. We have also been awarded additional support funding focused on engaging student mental health in schools. Please visit the MHTC Network website for additional information at mhtcnetwork.org. Next one, please. Funded by the Substance Abuse and Mental Health Services Administration, the MHTC Network includes Trend Region Center and a National American Indian and Alaska Native Center, a National Hispanic and Latino Center, and a Network Coordinating Officer. In our center is Region 2, serving New York, New Jersey, Puerto Rico, and the United States Virgin Islands. Next slide. Supplemental funding was awarded to provide training and technical assistance to teachers and school staff regarding students' mental health. The objectives of this activity is to communicate the importance of the mental health support in schools, enhance the capacity to recognize the identical mental health concerns in students, and that educate staff on the best model on schools-based mental health services and when to link the community-based services. Next slide, please. We have the capacity to experience and provide national webinars, general training, professional development meetings, and intensive technical assistance consultation services on school mental health topics that are listed in the slide. Next slide, please.
Carol, I'm having a little bit of an issue getting this one to advance. Hang on.
Don't worry.
There we go. All right.
If you are interested in staying up with updates and events and products, they're going to be sending the Bitly link so you can be connected to us. Following the webinar, you will be asked to complete a brief survey. We value this feedback and we use it to improve our activities and inform future activities. The survey is also important because our continued funding is linked to the completion of this survey. So we thank you in advance for your feedback. Next slide. We also want to let you know that this webinar is being recorded and will be posted on our conference website along with the PowerPoint slides within a week of the conclusion of this conference. The presentation was prepared for the Northeast and Caribbean Mental Health Technology Transfer Center under a cooperative agreement of the Substance Abuse and Mental Health Services Administration. All materials appearing in this presentation, except that take directly from the copyright resources, is in a public domain and might be produced or copied without permission from SAMHSA or the authors. Citation of the sources is appreciated. Do not reproduce or distribute this presentation for a fee without specific writing authorization from the Northeast and Caribbean Mental Health Technology Transfer Center. This presentation will be recorded and posted in our website. At this time of this presentation, Miriam Delphine Whitman serves as Assistant Secretary for the Mental Health and Substance Use at SAMHSA. The opinions expressed here in the view of the speakers and do not represent the official position of the Department of Health and Human Services or SAMHSA. No official support or endorsement of DHHS, SAMHSA for the opinions described in this presentation is intended or shall to interfere. Next slide. We encourage you to interact with our presenter during this webinar by using the chat features. Please also post any comments or questions you have in the chat, and I will collect your questions. I will go and ask them to the presenter during the Q&A time toward the end of the presentation. During the webinar, our presenters may pose questions to you. Please use the chat feature to answer these questions. Next slide. The MHTC Network uses affirmations, respectful and recovery-oriented language in all activities. This includes language that is strength-based on helpful, language that is inclusive and acceptance on diverse cultures, genders, perspectives, and experiences, language that is healing-centered and trauma-responsive, language that invites individuals to participate in their own recovery journey, language that is person-first and free of labels, language that is non-judgmental or voice assumptions, language that is respectful, clear, and understanding, and consistent with our actions, policies, and products. Now, I will let you in a couple of minutes with Dr. Burke. Dr. Burke is a school psychologist who has spread her career providing direct clinical services and system-level consultation and support to address issues in the childhood trauma. She is currently in the clinical director as a Children's Borough, New Orleans, a nonprofit mental health agency that serves children and youth by parenting with schools and other youth services organizations to embed and deliver trauma-informed care in community-based settings. Dr. Burke earns her doctorate at Talent University with a specialty in trauma-informed school psychologist and completed her clinical internship in the National Center of School Mental Health at the University of Maryland Medical Center in Baltimore. She's graduated of Hendrix College. Now we will turn over to our presenter, Dr. Burke. Welcome.
Hi, good morning. It is good to be here with you all today. I am from New Orleans and currently evacuated. So I feel like this whole trauma-informed care and trauma-informed approach to schools is kind of taking on new salience as we really figure out, what's next for our community and our schools. And I know many of you are in places, you've experienced natural disasters and worked with students in providing support and recovery in the aftermath of a disaster. So, as we engage in the chat and talk about examples, I'm happy to kind of think through some of those things as we are hopping into this new school year with lots of kind of uncharted territory around supporting students and the middle of a pandemic and lots of other stressors. So I'm excited to be here. Thank you for dropping your names and your roles in the chat. It's helpful to know who's here and who else in the training. It's virtual space is very strange. I usually love having like a show of hands and things like that. It's challenging when you're virtual. But it's great to have so many school mental health providers here who are interested in trauma-informed care. And it's something that, my agency and the work that we do, it's a focus for us every day. And, I think this year the need is especially high. So we will talk about some of those things, and I'm going to go ahead and jump in and get started. All right. Here we go. So before we dive in fully, I just want to mention that we're going to be talking about trauma-informed schools. And trauma-informed schools is a pretty dynamic concept. There is no one-size-fits-all model for school mental health or for the kind of larger idea of trauma-informed schools. There are many different stakeholders who play a role in creating trauma-informed schools, and there are many different systems. The example that I always use when I'm training is that New Orleans in particular is a system that's made up completely of charter schools. And so the way that we roll out and do support for schools who are implementing trauma-informed strategies is very different. We don't have a district level to work with. We work school by school because each school is really its own entity. And so the system that I'm talking about may have things that translate to the schools that you're working in. And there may be things that are substantially different and opportunities that are substantially different. So I just want to acknowledge that we really have to look at systems on their own and understand their specific needs. As part of my work at Children's Bureau of New Orleans, which is a nonprofit mental health agency, we serve on a City of New Orleans Trauma-Informed Schools Learning Collaborative. And we sit on that committee with Tulane University's Safe Schools NOLA project, which is a research project looking at trauma-informed schools and how we really operationalize and understand what the components are in a trauma-informed school, how we measure outcomes. We have the Institute of Women and Ethnic Studies, who are also a research entity, but they also do some direct level support for schools implementing SEL curriculum, trauma-informed sex education. They support some schools with universal screening, and we partner with them specifically on some of our school-based initiatives. The City of New Orleans Health Department is part of our collaborative. The Louisiana Public Health Institute, so again, another research entity who's really looking at public health strategies. the New Orleans Public School. So even though we're a body of charters, we do have an overarching organizing entity, which is the New Orleans Public Schools. Project Fleur-de-Lis, which is a national child traumatic stress network site. In our community, they focus a lot on dissemination of evidence-based practices to respond to mental health needs related to trauma. And then our organization, we have about 20 clinicians, and they go into the schools and deliver evidence-based group and individual interventions for trauma treatment. We also have several school-based partners who we work with and do consultation around like systems design work and how to really create systems that support the delivery of trauma-informed mental health care. So one of the lovely things about being a part of a learning collaborative is that the idea is that we are still learning and we're collecting data. We're working with schools, we're working with students to really understand the needs and to understand what works. So as we collect that data and learn those lessons, there's a real commitment to putting that information back out into the community so that it can be used. A lot of the publications and the research tools that we use are available on the Safe Schools NOLA website. So I've included that there so that you can check that out and look at that. And I have worked in schools, I've worked in agencies, I've worked in Baltimore, I've worked in New Orleans. So I say that to say is I will do my best to share the perspective, as many perspectives as I can. And my understanding of trauma-informed care is evolving. And I do think part of trauma-informed care is a willingness to be reflective and to learn and to adapt as we continue to evolve our understanding of what trauma-informed care really is. But I'm excited to have lots of folks on here and lots of perspectives represented. So please chime in the chat, put your information in here about your experiences. And I feel very lucky to have people monitoring the chat and the Q&A. So please drop those in and we will try to make sure we include all of those as we go through our presentation today. All right, so just a brief overview. We're gonna go over a little bit of background information, why grief and trauma, why now, and why schools. We're gonna cover a little bit of theory and research and really the shift in the field from thinking specifically about trauma-informed and really moving toward healing-centered. I love seeing all the programming at the conference and I love that it's really moving in that direction. We're going to talk about contextualizing and decontextualizing trauma-informed approaches, assessing needs and laying the groundwork. And we're going to talk about trauma-informed interventions and a little bit about implementation. And hopefully we'll cover all of that and leave enough time for questions at the end. All right. So talking about background, why trauma and loss? Why are we talking about this? I think it is not a shock to anyone. And I think in this last year, especially, we know that trauma and loss are widespread experiences that occur across the lifespan. By age 16, we have 2/3 of kids have experienced a potentially traumatic event. And when we're talking about potentially traumatic events, these include sexual and physical abuse, natural disasters or terrorism, sudden or violent loss of a loved one, refugee or war experiences, a serious accident or life-threatening illness, and military family-related stress. And these are just some of those. We also know that trauma exposure and mental health and school performance go hand in hand. We know that when kids have untreated trauma-related mental health concerns, it can affect achievement, it affects their social development, we see it in school outcomes, right? Do students graduate on time? Do they go on to do post-secondary academic things like college job training programs? And then we also know that interventions that support the social and emotional health of students also show positive outcomes, right? When we have things like SEL, good SEL, we have better outcomes for students. So, I think we're not going to focus on this too much today because we have a virtual room full of school mental health providers who I think this is something that is, it's well known. And I think coming back into a school year after a pandemic, I think this is definitely on the minds of schools and school leaders. And hopefully this is a focus and people are kind of primed and ready for this work. If they're not, I think that there's a great case to be made for why schools. Schools provide us with the opportunity for early identification. So if we see a kid struggling, we can intervene early. We also can do things that prevent further trauma. So having this approach in schools where we can identify students who are struggling or maybe have experienced a traumatic event, and we can get in and intervene early, we can prevent further problems from developing. We also have the opportunity to provide supports daily. So, I think if you're doing school mental health work, it's one of the greatest rewards to be able to see a kid using the skills that they've learned in a session out in the classroom, out in the playroom, and there are opportunities there to reinforce those. There's also opportunities to learn new skills, right? So if we have SEL curriculums, kids are learning strategies to manage their own emotions, to manage adversity, and learning those skills can often then prevent mental health, more negative mental health outcomes later on down the road. We know that early intervention is more cost effective, so that implementing a classroom-wide SEL curriculum and building those skills early on, you may not need deeper, more individualized services down the road. And at the end of the day, schools have a mandate to provide educational services to qualifying students so that, free, appropriate public education, it applies to all students. And if trauma is the thing interfering with their education, schools have a mandate to make sure that students have the right supports. And then finally, schools are an important safety net. So, we know for many students this year, in our community in particular, we saw a decrease in reports of child abuse. And part of that was we know students weren't in school. And so the people that may be able to recognize and prevent further trauma, that those safe adults are not seeing kids face to face every day. And so, schools can be an important part of a safety net to recognize when kids are in danger and to help put in place supports that increase safety. All right, so why now? I think this is probably the $1 million question as we come back into the school year. We know that this past year and a half has disrupted the lives of children and youth. COVID-19 in particular has resulted in the loss of jobs and livelihoods for many families. Students have lost day-to-day physical connection with, and teachers too. They've lost connection with colleagues and with friends. I think with students, they've lost connection with teachers and people that they care about. And that's been really challenging. I know for a lot of our high school students, that peer support is such an important part of their mental health. And a lot of our high schools stayed virtual throughout the year. And so that physical connection was not there. We know that there's been a lot of loss of life. I think the last statistics that I checked when I put these slides together was 613,000. And we know that more than 40,000 children have lost caregivers. And that number, there's a pretty large range, but I think the most reliable and published number is 40,000, but there are estimates that are as high as 100,000. So I do think that we are going to have kids coming back into the school environment who are going to need extra support and who are really going to need a trauma-informed approach for them to fully engage meaningfully in the educational environment. And I think it's important to remember that teachers and school leaders and school mental health providers have also experienced loss over the last year and a half too. And so, that trauma-informed environment is not just for children and students, it's for a healthy school environment so that everyone can be productive and everyone can feel supported. We also know that in this last year, there have been increases in criminal violence in many cities, and we know that there are elevated risk factors for abuse and domestic violence. Although, like I said, we have not yet seen the numbers really bear out because we haven't had, at least in our community, schools and a lot of our emergency services reopen fully. So I think the numbers, we're still kind of waiting to see what that looks like. But we know historically in the past, a lot of the risk factors that came along with COVID-19 are the same risk factors for increased abuse and domestic violence. I think what we can't ignore either is that in the last year and a half, it's issues of historical oppression have really been pushed to the surface. They have been there all along for many, many of our students, but I think the fact that they've been pushed to the surface, for schools, it's an issue that cannot be ignored, and it has to be baked into any sort of trauma-informed or school mental health intervention. And we have to really acknowledge that COVID-19 has had a disproportionate impact on disadvantaged students in our community. We know that Black families and a lot of the immigrant families are involved in New Orleans is a big tourist town. And so we know that a lot of the families who are in hospitality industry have had incredible amounts of loss in terms of income. They were also called to be, back in jobs that put them in harm's way. And they didn't have access to childcare when schools closed. And so, for us as a mental health agency, we've had to work really hard to find the right kinds of supports and ways to work with students when, they're at home and may not have a supportive adult at home. So I think we have to really think about coming into this year with a lens toward trauma-informed supports and really thinking about how do we meaningfully connect with students who've been disconnected. And I think that's really at the crux of building a system that's trauma-informed. So a lot of the things that we're going to talk about today are systems level approaches, and hopefully that framework will be useful as you go into the school year and think about the programming and the kinds of supports that you will need in place for students. So SAMHSA has kind of their overarching idea of the 4 R's, right? What is trauma-informed care? And trauma-informed work is happening everywhere. It's in juvenile courts, it's in child welfare, and it's in schools, thankfully. And so when we're talking about trauma-informed, we're looking at systems that realize the prevalence and the impact of trauma, that recognize the signs of trauma and the need for specific supports. And then looking at how we respond to trauma and also avoiding any re-traumatization, right? We don't want schools that that feel unsafe and that may re-traumatize students. We can't do a lot of response and support if school itself doesn't feel safe. This model, right, it's a very general, very kind of high level. It doesn't get in the weeds and give a lot of guidance as to how to do this. And so I think as a field, I'm saying just kind of efforts towards trauma-informed practice, we've really struggled in how to carry out and realize this, this vision. And so what I'm going to talk a little bit about today is that journey and how we think about systems and systems level work. So there's a folktale from India, and I'm sure many of you have heard this, about 6 blind men, and they're standing around an elephant, and one is standing near the trunk and they feel it and say, this animal must be like a snake. And one of them feels the tusk and says, no, this animal must be, it's like a spear, it's sharp. Another one stands next to the leg and says, I think this animal's like a large cow. The person standing at the end near the tail says, no, it's small and rough like a rope. And the story, right, is allegorical. And the wise man who comes along and says, no, you're all right, It's all of these things, and you all need to put these pieces together to form the whole picture. And I think that's often what we see with trauma-informed care. So it's not just the right PD for your teachers and staff. It's not just evidence-based interventions for trauma for students. It's not just the right SEL curriculum or a well-implemented restorative justice practice. It's all of those pieces together. And the idea that not one size fits all, right? Every school is going to need something slightly different. And so part of that is also just the reflective practice to be able to look and critically examine, what are we doing well, what's working and what isn't. So I came to the work of trauma-informed practice in schools as a mental health provider who worked with students who were sexually abused. And so, my first introduction was coming into schools and delivering evidence-based mental health care. And what I learned very quickly is that work can't always be done in schools. If school isn't a safe environment, coming in and doing trauma-focused CBT may not be the right call. And so the system really has to support at all levels and really have the right kind of climate and the right kind of environment for those interventions to be delivered. And so just pushing in as a mental health provider, I can't make a school trauma-informed, or a school leader investing in the right professional development or ACEs training for teachers, again, is not going to result in a trauma-informed system of care. It really has to be comprehensive. So when we think about that whole picture, it's important to really think across tiers of service. What are we doing to prevent? What are we doing to build resilience in our students at the universal level? And for those students who need more, what are we putting in place, and are we putting the right structures in place to make those interventions successful? So given the widespread exposure of trauma and loss, especially over the past year and a half, it's going to be really essential for schools to facilitate resilience and promote healthy recovery. And in the school mental health literature, we're starting to see what that looks like in terms of carrying it out and really implementing systems level change. Overstreet and Chafoulias are both two. So I will say Dr. Overstreet is at Tulane and runs the Safe Schools NOLA lab. And their lab is really working to really understand how we operationalize what trauma-informed care is and what kinds of support schools need in place for systems level change. And Dr. Chafoulias is at University of Connecticut, and she's doing the same. So, I think there are resources out there, and we're starting to see it in the literature more and more. And as we look at this, I think something to remember as we go today, SAMHSA's principles of trauma-informed care: safety, trustworthiness, and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, and cultural humility are the things that really should undergird any interactions that we're having in a trauma-informed system of care. And that means that's the environment that staff should have, that teachers should have, that families should have. It should undergird all of those interactions. And anytime you're examining or doing any sort of self-examination of, am I doing this? Is this consistent with the values of a trauma-informed system of care? These are the questions that should be asked. And so, again, I get it's not super prescriptive and it doesn't give a lot of direction, but we're going to talk about what that system might look like and how to really think about building that out. All right, let's see. Actually, was really excited to hear that your first session was around, was youth, kind of focused on youth voice. That has been something this year that I've had the privilege to be a part of in New Orleans. we've been working with an organization here to do a dismantling adultism training. And it's youth-led, and youth voice is kind of the prevailing principle. And how do we make sure that the decisions that we make for youth are done with youth voice at the center? And it has been such a fascinating and rewarding process. And I've really, really enjoyed it. I don't know if you have dismantling adultism trainings in your area, but it is. All right, let's see. So there we go. All right, so I think very fairly, trauma-informed practices, not just for schools, but for courts, for child welfare, has received fair criticism. And that criticism is focused primarily on the fact that when we center trauma, we end up over-pathologizing groups that are often already marginalized. And we also fail to kind of see trauma as it in the context of the whole person, right? A person is not their trauma. If you've done individual treatment work, right? The biggest, I think, working with, especially like survivors of abuse, the fear that they will be defined by their trauma is really at the crux of how we make meaning and build resilience, right? And I think when we build systems that are focused on trauma, there is a risk there of really trauma becoming centered in terms of someone's identity. And so this push in the literature, in trauma-informed training, in how we move forward in this work is really a shift toward healing centered. And I think that that is really important as we build systems of care, is that students are not defined by their trauma. And we want to build systems that support their development, and also support their healing if there are trauma-specific mental health concerns. But we don't want that to be the be-all, end-all of how we see and understand students. So I think the shift to healing-centered is really important. And when we're thinking about healing-centered work, we're looking at things that promote healthy development and build skills when students do face stress and adversity. Issues of equity need to be centered. Are students across the board experiencing the benefits of these interventions with equity? Are they impacted disproportionately by discipline policies and things that we've put in place and that we may think are making our schools safer? They may not be. And so I think it's important for schools to really examine things through an equity lens, to recognize the role of historical traumas like racism and discrimination and how they've been a part of schools and the school environment. We need to be able to find avenues and ways to elevate voice and choice in the process of creating trauma-informed systems and healing-centered systems of care, and have opportunity for transparency and to honor cultural practices for healing. All right. So if you have been in the world of school mental health for any amount of time, we know that tiered responses are a major part of how we conceptualize our interventions and our work. And we know that students experience lots of different kinds of hardship, stress, and trauma, and therefore we're going to need interventions that target different levels. We're going to need to really understand how grief and trauma can impact individuals differently. We want to be able to determine the right level of care, right? Just because someone experiences a traumatic event, we don't need to push everyone into tier 3 supports if that's not indicated. And we also want to think about how individuals move across each tier of response, right? We don't want everyone to go immediately to tier 3, but we also want people who are in tier 3 to be able to move out of tier 3. And so really thinking about what systems we have in place to understand those needs and to move them across those systems is really important. And we want to think about, what interventions are in place at each tier to really provide the right level of support. So I cannot take credit for this beautiful graphic. This is Dr. Trifolius's, I think this article came out in June of 2021. So if you have, there we go. If you have access to, I think this is in, sorry, I cannot see my reference because I've got my, it's in the Journal of School Mental Health. Oh, let's see, I've got a question. All right, I'm gonna let my, moderators handle questions, and we will hopefully get to those at the end. But I really love that this article looks at ACEs education and really how we translate this idea from knowledge into practice, right? So if we're trying to train teachers to understand, to recognize the risks associated with exposure to trauma, you know, what are we putting in place that builds on that knowledge and that really puts that knowledge into action? And so you'll see here in this graphic at the bottom, we have the 6 trauma-informed care principles that kind of undergird everything. And then we have these interventions, right? The universal interventions that are trauma-sensitive strategies that are provided. They're provided to everyone, and their intent is to promote positive adaptation and prevent risk. More targeted interventions may be things like group or small group interventions that are, again, trauma sensitive, and they're supplemental strategies. And then your selected are kind of the intensive supports. And you'll see that on the left side here is whole child, and on the right side is whole school. And so the idea is that we can't advance one without the other. We have to be looking at the whole child, and we have to be looking at whole school response. And we have to be able to do this while looking at it from an ecological perspective, right? School and community supports have to be leveraged together. And I think, you know, the work that we do, we're a community-based agency, but we know transportation is a major barrier for many, many of our families. We don't have a strong public transportation system in New Orleans. And so oftentimes where kids are the most successful in accessing care is in schools, but schools don't have the bandwidth to deliver those services. And so it's really thinking about how you leverage the resources in your community to build out this triangle, and the understanding that schools really, they can't do it alone, and it's not indicated that it be done alone, because the community has to be a part of the effort. All right. I feel like I could do just an entire day-long presentation breaking down this graphic. It's really lovely and really well thought out. All right. So what I want to do with our remaining time is just to kind of walk through what I've tried to do is break out for each of the tiers what some of these resources might look like. And I've also included some slides that have links to resources that can help implement some of these strategies. So at a universal level, right, at tier 1, we're looking at strategies that promote safety, wellness, and connection. We know this past year has been disconnection has been one of the biggest challenges. So I think thinking very strategically how we come back in and start to build connection is really important. One of those things, resource mapping, you know, what do we have in our community? I will tell you, in our community, the pandemic has closed a lot of mental health agencies. And so, you know, schools are scrambling now. What services do you offer? Do you know if this agency is still open? You know, can we still accompany a kid to the emergency room if they're in crisis? What is the policy? And so there's, you know, a need at the beginning of the year to do some resource mapping. There's a self-assessment of our policies and practices. Are they trauma-informed? Are they serving all students? Staff check-ins. We know pandemic-related stress is real for staff too. You can find on the Safe Schools NOLA website a study we did during the last school year looking at the impact of the pandemic on teachers and just what different needs emerged in terms of mental health. And we're doing a follow-up study to that. Actually, we're just got in all the data, and we're looking at that in the next couple of weeks. So we know that information sharing and felt safety is important, especially from school to families and families back to schools. What does your mental health infrastructure look like as you're coming back into the school year? Are there clear referral pathways? Do you have clear ideas of how to move kids up and escalate kids with higher levels of need? One of the things I've really found this year is finding ways to reestablish routines that promote connection and joy. One of the things my kids' schools, they do a morning meeting, and the music teachers have a band and they play music as kids are coming into school. And it's one of those things, like the first few times I went, I was like, oh, this is nice. But then, your kids always want you to stay for morning meeting, and sometimes morning meeting runs over and it's a little like tenuous, because then you've got to separate from kids, and it's lovely. But with the pandemic, I missed it so much. And at some point they figured out a way for the music teachers, like every Wednesday morning would do live music and sing along. And it was such a fantastic thing to be able to have that again, and to reconnect and have that. They're still doing it virtually. We haven't fully returned to that, but that routine and that connection is just, it cannot, you can't underestimate how valuable that is. So thinking about what kinds of things we have in place for self-regulation, supporting staff and students, avenues for voice and choice as we come back into this year, how are students, how are families, how are teachers' voices being heard in this process? Are there avenues to examine issues of equity routinely? How are self-care and peer support promoted? For our agency in particular, peer support, informal peer support, was such a major part of our work. And with the pandemic and not being in the office, we really lost that. And that's something that our staff has really expressed a lot of need to come back together and to have that opportunity for peer support. And so we've had to kind of create virtual platforms for peer support, and be more intentional about it, because we don't have the opportunities for informal peer support like we used to. What kinds of professional development is needed? What kind of time and resources are being allocated to SEL? I know that you guys have some more training sessions on SEL later today, which is great. And what kind of discipline practices are we carrying into this school year? Are they trauma informed? One of the things that we do with our school partners is some mapping work, and we really look at how students move through the different tiers of support and what services exist in each tier. And so we'll sit down with them and really map out, this is kind of a shell of that, but we'll put in dates of when is our universal screening happening? What's our target date for data review? How are we going to use this data to move them into a higher tier of service? What kind of community partners are we going to pull in? So each color here would represent a different community partner. So we may have someone who comes in and does universal screening, but then the school team comes together and does a data review. And then we really look at how we move students up through different tiers of service, and what kinds of things we need to have in place to have those community supports available. All right. So I've included here some tools for evaluating, assessing, and mapping school mental health and trauma-informed care. The National Center of School Mental Health has the SHAPE system, and that helps you do a review of kind of what services you have in place. It's resource mapping. Safe Schools NOLA, one of the faculty members here, has developed the attitudes related to trauma-informed care, the ARTIC. So it's a great way to evaluate readiness to do trauma-informed care in your schools. And then we work with specifically an organization here called Beloved Community, and they do equity assessments for schools and nonprofits. And in our work with Beloved Community and our trauma-informed schools work, they do a climate walkthrough, and they do a walkthrough of the school with school leaders and really look at indicators of climate. It's fantastic. So there are resources out there, and I have a few slides like this where hopefully these links will be useful later on after the presentation is over. So as we're looking at more targeted interventions, this may be like a great screening system. How are you evaluating kids who have risk and trauma exposure? I think this is something to go into with a lot of planning and preparation. Screening is, it brings with it a lot of needs identification. And so if we are going to go in and do screening, do we have, for example, the correct supports on site to make sure that, if a kid discloses abuse when you're doing a risk screening, that you can follow up and make the mandated report, or that you have a clear pathway of referral if they need a higher level of support. Are you available to make the referral to the hospital if they disclose suicidality? So there are a lot of things to think about if you're implementing screening for trauma exposure and mental health concerns. There's a great article that's linked in the next slide that really talks through a lot of the screening measures, but also what to think about in terms of implementing screening. What kind of group interventions do you have in your school? What kind of peer support, both for faculty and students? We know that trauma-informed processes, what kind of things are in place that move kids towards more individualized support? So are those processes trauma-informed? Is your process of moving a kid towards special education services, right? Does it have transparency? Is there opportunity for voice and choice in that process? I think one of the things as we move into this year, an awareness of secondary traumatic stress and impact on school staff. How are we supporting staff? How are we making sure that staff have outlets when they are feeling really stressed? One of our organizations that we partner with through the Trauma-Informed Schools Collaborative is they're doing support groups for teachers. And so there's some virtual support groups to really focus on teacher mental health. Mm-hmm. So when you're virtual, are there still ways to maintain and build connections? Are there strategies for engaging disengaged students? What kind of family input are we seeking at this level? When we identify challenges that exist in school climate, do we have strategies to address them? Are there supplemental supports for SEL programs, small pullouts for kids who may be struggling? And are there developmentally appropriate psychoeducational opportunities about trauma and resilience? And are we identifying resources for staff, right? EAP or specific community providers who work with teachers. All right, so finally, we're going to talk a little bit about screening and assessment. I think this is one of those things that you could probably do an entire training on, but I think as you work toward that, thinking about all the resources that are needed and how your school is going to do screening meaningfully is really important. This is the article that I was talking about, and here are the resources that are that can go along and provide some additional tools for screening. So the National Child Traumatic Stress Network has a review of screening and assessment measures. It also has some guidance on doing screening in schools. The UCLA PTSD Reaction Index has released a free COVID-19 screener for children and adolescents, so looking at experiences during the pandemic and related mental health distress. And then the article that I was talking about here in School Site Quarterly has a really good review of kind of the process of screening and what are some of the things you need to think about before implementing a robust screening program in your school. Okay, so finally, we've got tier 3, and this is where, as a school mental health provider, at least for me, this has always been my comfort zone. Individual and group intervention feels familiar. It feels like what I'm trained to do. And I think for me, at least, the systems level work has been more challenging and has been something that I've been able to grow into. And so hopefully this piece of it, there are lots of places where you have opportunities to get trained in evidence-based trauma interventions. So, for more individualized work, that may be TFCBT. For group interventions, we have CBITS, or Cognitive Behavioral Intervention for Trauma in Schools. Our organization has an evidence-based intervention. It's a 10-week group intervention called Grief and Trauma Intervention, or GTI. So we implement that in school-based settings. And then there's also an intervention that can be group or individual called Traumatic Grief Components Therapy for Adolescents. And the references for these are in the reference section on the slide if you want to get more information. What we find when we work with school mental health providers, there's often a challenge in implementation, that the bandwidth to implement these is the biggest barrier. So part of what we've done is, when we train a school-based clinician in GTI, we'll often pair one of our clinicians with that trainee so that they have someone, our clinician comes in and brings all the materials and all the prep. And so we often try to think about ways that we can extend school-based providers, because we know that it's a challenge to be able to implement some of these interventions, just because they do require a lot of prep and a lot of follow-up on the back end, depending on the content of the session. So part of Tier 3 may be managing some of those school community partnerships. So we know that a lot of the school mental health providers in our area, they may schedule kids' individual therapy appointments. So if we have outside clinicians coming in, they're making sure that we have space and that the student's teacher knows what time that they're supposed to be pulled for individual therapy sessions. At Tier 3, you may have consultation, you may do some postvention after crisis events, thinking through what kind of peer support and peer navigation programs could be implemented. Teacher mental health supports, are there good employee health benefits? And if not, are there organizations in your area that do support for teachers? And then I think when we're thinking about screening and identification of need, we're looking at ongoing monitoring of traumatic stress levels. Are there trauma-sensitive referral resources? Are there trauma-sensitive practices in our special education supports? Are there trauma-sensitive practices in how we do behavioral support plans? So we're looking at kids with that highest level of need and really thinking about what role trauma plays in that need and what kinds of interventions are most appropriate. And again, really thinking through and making sure that what we're doing is culturally responsive and it really fits with the needs of your student community and your teacher community. All right. So I'm going to skip these two slides. It's about choosing the right intervention for your school. I think it's fantastic guidance. You can find a more fleshed out version of this on the National Child Traumatic Stress Network's website, but it really helps you think through when you're choosing interventions for your school setting, what's going to work and what, or where barriers might exist when you're doing implementation work. So here are some great resources on where you can find reviews of evidence-based programs for trauma-informed care in schools. And these are mostly treatment and therapy interventions. So really things that we're going to have at that Tier 3 and most targeted level of intervention. So I know our time has gone so fast, and I want to leave plenty of time for questioning, but I think what we really want to think about is how do we start to bring all this information together, right? How do we move our knowledge into practice? And how do we make that practice reflective and adaptive to outcome data, to the voice of students and the experience of students who are part of that system? And how do we really make systems that are responsive to that kind of feedback? So as we're thinking about implementation, we want to have critical eye toward context What is the environment where we're implementing, and what kinds of things do we need to know about our environment to make the right kinds of changes? How do we shift to be more holistic focused? How can we be more whole child driven and keep an eye on systems level work, making sure that along the way, those 6 principles of trauma-informed care are embedded in all those interactions, and really thinking in that dual role of child level and school level response. Who are your stakeholders? How do you make sure that their voices are at the table? And how do we think about implementation meaningfully and intentionally? And so I think it's really thinking through in your school community, what is your consensus around core features? What kind of measures do you need to look at to understand if your approach is working or not? What system level supports do you need? Do you need some workforce development? Do you need sustainability planning? If you have money from the CARES Act, right? Maybe that's temporary funding. How do you make sure that what you build can be sustained over time? How do you evaluate inputs and things like fidelity to the interventions? How do you monitor outcome? What sort of resources do you dedicate to that? I will say one of the things that we've done, and I think was a hard lesson to learn in the early days of the Trauma-Informed Schools Learning Collaborative, is, we did these great professional development summer workshops, and we realized that it was great, but then we would have, a good amount of teacher turnover. And one of the challenges was sustainability. And so we moved more for our new cohorts into like older schools who've gone through the workshop, is they have identified coaches who work with the newer schools who are training. And then we also have a trainer of trainer model. And so, we really tried to work to address the issue of sustainability, which we quickly learned in terms of turnover really posed a lot of challenges for us in terms of sustainability. All right, let's see. I'm having issues with my slide advancing again. Let me try. There we go. All right. So I think one of the things that I often hear from school mental health providers is, what is my role in all of this? If this is a whole systems change, right? If I need my whole school, my whole district to kind of change the way they're thinking about this and change practices and policies, what is my role in all of this? And I think what I will often say is school mental health providers are some of the most knowledgeable, adaptable, and consensus building group of folks that I've ever worked with. And I think that we have the ability to think about kind of hold the child and the system, in our mind as we move forward and make decisions. And because we do have an understanding of the system and how kids move through special education processes and things like that. And oftentimes we're really advocating for an individual child within those systems. I think finding ways that, finding champions and allies in the process are really important. And that you're gonna have to have, people by your side as you do this work. It's not work that can be done in isolation. It's not work that can be done alone. But we do bring unique skills to the table. We are good at building consensus. We're good at building, working collaboratively. We know how to do database decision-making. We know how to evaluate outcomes. I would love if there are other things, what superpowers do you bring to the table? If you want to drop those in the chat, I always love asking this question because I think we do bring unique skills to the table. And how do we build on these skills to create systems level change? So I say all of that to say, you guys are in a unique position to address some challenges and opportunities that exist going into this unprecedented school year. Trauma-informed and healing-centered approaches work, and when implemented with fidelity across tiers of support, bolster student resilience and recovery. We have to pay attention to the implementation, and intentionality matters because we want to promote healing and we don't want to do more harm. And we know that this year is going to be challenging for school admin and staff. think about partnerships and opportunities that exist in your community to bolster your own resources. But yes, get going. There is much, much work to be done. I have one more resource slide for you here. There are two great publications on supporting student mental health after COVID-19 or in the middle of COVID-19. So I think both of these are incredibly useful and hopefully will come in handy as you start doing some of your planning for this upcoming school year. All right, I'm going to turn it over to questions. Oh, I love active listening. Yes, that is a great superpower. Non-judgmental perspective. Yes. I may borrow some of these and add them to my list. Yes, I can go back to the previous slide. All right. So these two resources, one is from the MHTC Network, and the other one is from the National Child Traumatic Stress Network. Both really robust resources. All right. I'm going to also just like understanding a student's story. Yes. Yes.
Dr. Burke, we have a question here. It says, has New Orleans been successful in actually modifying and adopting new policies that truly change school practitioners' academic practices that allow for the role hold children in fields of opposite only academic growth in the State Department of Education and Engagement activity?
It's a great question. So, like I mentioned earlier, we have this very odd system in New Orleans in that there is no public school system. So we are a network of, I think it's like 80 different charters. So when I say that every school is its own LEA, its own entity that like sets out its goals and its strategies, it is truly a school by school or charter network by charter network approach, which makes some great opportunities, but some real challenges in doing whole systems level work. So, one of the things in New Orleans is that, one of our school partners that we work with is very, very invested in this. So, they pulled in part of our Trauma-Informed Schools Learning Collaborative. They actually do their training for teachers in SEL curriculum. They've been retained to do universal screening. They help analyze that data. So they have them on the front end. They have an outside organization that provides the school social work services. We do systems level consultation and evidence-based trauma treatment and some staff PD for them. So this is a system of 4 schools. It's a charter network with 4 schools, and they're incredibly invested in seeing this play out. They have restorative justice as part of their discipline strategy. They've really put the work in, but it's a 4-school system. And so for us, one of the challenges is being in this in the city where we are and doing the work that we do is that getting that to happen kind of in a bigger picture way, the system doesn't support that. So we do have some interesting things happening. Our State Department of Ed they've gotten a grant and they are paying for evidence-based trauma treatment, but they've really run into some challenges in terms of implementation, and that there's it can't supersede Medicaid payments. And so students have to be able to show that they're low income, but not have Medicaid. And initially the burden was on schools to do that documentation. And they recently shifted it now that providers have the burden for that documentation, but there's still some challenges in implementation. So the State Department of Ed, I think, recognizes that the need is there. But again, it's about, right, we're thinking intentionally about implementation and being able to analyze when the practices and the that you've put in place may create different and new barriers. And so being able to think critically and responsively about those. So they have made some changes to that system. And I think I'm actually scheduled to go to a training in the next week or two about kind of what those changes look like going into the new school system. How can we support staff wellness when we do not have a budget for this? We have grant funds for student support, but not staff support. That's a great one. You know, I think a lot of our organizations locally, schools and mental health organizations, look to outside community partners. So it may be making sure and looking at, you know, who are the providers that are on your insurance panel, right? Who work with teachers or may have specialized knowledge about working with educators. We have a community-based organization here who does a group for educators, and it's just you can call in. It's a virtual group. It's a drop-in group. And then some of our schools have also just created peer support, right? So is there an opportunity in the week to do more intentional peer support work? All right, can you kindly provide a link, direct link contact to universal screening? That is one where I cannot, this organization specifically does it as part of our Trauma-Informed Schools Learning Collaborative. I don't think they work outside of New Orleans. But I do know that there are resources, especially if you go back to the SHAPE system through the National Center for School Mental Health. I know there's some resources there around universal screening and supports for universal screening. I will say, I think for us, some of the best supports that we found, our Children's Hospital has started to get into the game of providing some supports around universal screening, sort of like they do vision and hearing screenings, right? So thinking about who are some bigger providers with more bandwidth in your community to do that. And then also, I think you've got universities often will have some resources, right? Because it's about managing large amounts of data and also the clinical impact of that. But there are some resources out there. I think it's one of those things that people talk a lot about, but really the lift for schools is really large and is often, a challenge for a school system to take that on, because it requires personnel, and there's the cost and the data management. There's a lot that goes into universal screening. But I know, Michelle, if you would like to connect offline, I'm happy to kind of talk with you about how we've done, manage some of those partnerships. But it is a challenge that a lot of the schools in New Orleans struggle with. All right.
Can we go to the next slide?
Yes, I can do that. Let's see. There we
So
go.
if you have any other questions, you can write it in the Q&A or in the chat. So thank you very much for all your questions. The MHTC Network is funded through SAMHSA to provide trainings. As part of the receiving these funds, we are required to submit data related to the quality of this event. At the end of today's training, please take a moment to complete a brief survey about today's training and conference session. You may either use the QR code reader, or we will also share the link of our relation in the chat box. You can also go to the next one.
Yeah. Let's see. I don't know why my slides is sometimes it advances really easily, and then we've gotten, there we go.
No worries. We understand that the information presented can be sensitive. We also would like you to guide our educational training and technical assistance effort by completing our need assessment. Please scan the QR code on your screens to access the assessment. The link will also be shared in the chat box. If you have any other questions, you can also ask them. Next slide, please. We understand that the information presented can be sensitive in nature. We encourage you to take care of yourself and each other. On the screens are some and links and numbers for resources that you can find helpful. Next slide. We encourage you to join us in our next session, the Comprehensive School Mental Health Addressing Elevated Stress to Trauma in Schools. It will be 11:30 to 12:45 Eastern Time. The direct link will also be shared in the chat box. Next slide, please. We would like to thank our presenter for joining us all today, and we appreciate your participation and look forward to joining us in our next session. We also have people telling you in the chat, Dr. Burke, that it was very good having all this information. So thank you very much.
Excellent. Thank you, guys. And I hope the rest of the conference goes really well.
Carol, you can click end for all.